Good afternoon, everybody. Good afternoon. Sorry to change the time today. We had an important call, all of the governors and the president and vice president and some members of his cabinet, so I felt it was important that I attend that call. We have a lot of news today. I have many announcements and many updates, so this will be a bit longer, but it's all essential information, and I thank you all for tuning in today. And again, big thank you to members of the press who are working overtime to make sure we can keep the people of Rhode Island properly informed. You can see the data on your screen. Unfortunately, our cases continue to rise. I keep waiting for the day when they start to decline. We're not there yet. Today we have another 437 cases. It's our 5th consecutive day of increased cases. And as you can see, we're not where we want to be, but we also aren't flying up the curve the way we were. So we're in a stable situation, and we hope that sometime soon we'll come back down the other side. I would say, as we enter a weekend, and as people are getting more and more bored in their homes, I would just again implore you all to obey the stay-at-home order that is still in effect and will still be in effect until May 8th. It wouldn't be in effect until May 8th if we didn't think it were absolutely necessary. This is a really important moment right now. We're doing great. We haven't seen the surge that we could have seen. We haven't seen the horrible experiences of some other cities and states that have had their healthcare systems completely overrun, and that's because we've been following the rules and doing the hard work of social distancing. So stay-at-home order is in full force and effect until May 8th. That's just around the corner, and I'm asking you all to hang in there. The results that you see show a clear flattening of this curve, and I'm asking you to hang in there for a couple more weeks so we can get back to work as soon thereafter as is safely possible. Okay, on to the important announcements. So when we think about reopening the economy, which is certainly on my mind and everyone's mind, we know that having adequate testing is essential. When we started this crisis, we had one testing center in the state of Rhode Island, which was at the Department of Health's lab. And now we have dozens of testing sites all over the state. We are using multiple commercial labs. We're at a place where we're testing nearly 3,000 people a day. And testing is a key component to allowing us to go back to work and back to school and back to life safely as we deal with the virus until we have a vaccine. You should be pleased to know that this is an area that Rhode Island is doing very well. I just got off of a call with Dr. Birx, and she gave a shout out to Rhode Island in front of all the other governors, saying Rhode Island has tested the most people per capita of any state in the country. And that's a great thing. And on a daily basis, we're testing more people per capita than most countries around the world. So Rhode Island is really at the top in terms of best practices, and that should give you a sense of security and confidence and safety that we are on top of this, and we're going to keep Rhode Islanders safe. At this point, we've tested about 4% of the entire population in Rhode Island. But there's more work to do. So as hard as we've worked, and by the way, so many people on my team are this has been a 7-day-a-week effort for 6 or 7, 8 weeks, and I want to say thank you. We still have to do more, particularly in our vulnerable populations. And so I want to take a minute to talk about some of our vulnerable populations. One setting that we are extremely focused on is our nursing homes. We've seen it all over the country. Older populations have the worst outcomes with this disease, and people living in close contact in communal settings, it's just very hard to control the disease. So we are laser focused on nursing homes. Earlier this week, we launched a mobile testing team to support patients and staff at nursing homes, bringing the equipment to the nursing homes. And I've heard from many of you that that's been working. We are now looking at other options to reach vulnerable and homebound individuals. So we're working with EMS, the National Guard, and URI, who is allowing us use of some of their vehicles to provide mobile, on-the-spot testing for those unable to get to a testing site. So next week, I'm going to have more announcements about this mobile testing effort, but I did feel it was important to let you know where we're going. You know, throughout this crisis, I have tried to say to you, you know, here's where we are. It is not perfect. I hear your anxieties that we need to get better. And so here's where we're going. That's what I'm telling you today is, I know we need to do more mobile testing. We need to get more into the community. We need to get to nursing homes, assisted living, you know, other areas of congregate living. And so we're working very hard to find the equipment, the teams, the trucks, the transportation, the reagents, coordinate all that logistics. It started, it's working, and we're going to really start to push it out more next week. We're also increasing testing access for the hardest hit neighborhoods, some of the poorest neighborhoods, neighborhoods where folks are very densely, in dense living situations, and where frankly not a lot of people have cars. So we've announced walk-up testing sites in Pawtucket and in Providence. I've already heard these testing sites are making a big difference in these communities. They're each testing more than 100 people a day. That is a great thing to know, that people in those communities who don't have cars can just walk over to the parking lot and get tested if you have an appointment. And I want you to know we're going to do more of that. It's been successful. We have a lot more to do. So in the next couple of weeks, we're planning to add walk-up sites and other testing facilities in communities where we know there's a greater need. Communities in Cranston, more in Olneyville. We need to get to Woonsocket, in the East Bay, Central Falls. These are all on our list. We hear you, we are on it, we're working as fast as we can to bring the testing to you in walk-up settings, because we are fully aware that not everybody has a car. I'll say this, I am highly focused on vulnerable populations. We're not where we are, but we're getting there. We're getting there faster than almost any other state in America, and we are going to stick with it until we have the kind of widely accessible testing everywhere. If you look at the experience of other countries, for example, Singapore. You know, Singapore at one point, a month ago, it seemed like they had this under control. Except now they're on complete economic lockdown again, because they had a community of migrant workers living in a communal situation, and they took their eye off the ball on that vulnerable population. And so we don't want to do that. We do not want to, we want to learn from that experience, and so that's why you're going to hear me talking a lot about testing and quarantining and support for vulnerable populations, because we can't let anybody be behind. By increasing our testing capacity, it's more than just the diagnostic tests and then putting folks into isolation and quarantine. It's also understanding more about the overall prevalence of the disease in our community and in our state. And many of you have been asking me about the antibody test. Members of the press have been asking me. So I'd like to take a minute to share with you our view and our plans. So earlier this week, we received a shipment of 20,000 antibody tests. These are finger prick tests. They're blood tests for antibodies in a person's system. Now that we have the tests in our possession, the first step is to validate those tests. And that's a process which we will do here in our state. We're working with experts in our hospitals and at Brown University, and we're going to validate the test, and then we're going to test a sample of randomly chosen people across the state of Rhode Island to try to get information about the prevalence of the virus in our state. We know, obviously, that a lot more people have been infected than we've been able to test. I mean, that's a fact. We don't know exactly how many, and so the whole point of these serology tests, the antibody tests, is to give us a better sense of what's going on broadly in the state, what % of our population has had the virus, what %'s been exposed to the virus, and therefore their bodies are developing antibodies. Now, I want to be clear about a couple of things. These kinds of tests do not replace the diagnostic test. The purpose of these blood tests is to give us a picture of what's going on in the state, how prevalent is it, where are the hot spots. They are not intended as a way to tell you whether you have the virus and you are positive. That's why we still need to go what they call the Pcr test, the test with the big machines, which is based on your saliva or they use the nasal swabs, and that's at CVS or in other places. I also want to be clear, this isn't a quick process. So conducting the random sample with the serology test and analyzing the results for prevalency takes time. It takes more time than it does for the current nasal swabs that we are using. And it requires expertise and science to get it right. And my whole name of the game from day one is to be focused on facts and science and be highly professional and expert in everything that we've been doing. So to that point, today I'm announcing that we are assembling a testing and validation task force with experts from around the state to help analyze and draw conclusions from the data that we find with these serology tests. And I want to announce that we have two fantastic co-chairs of this task force, both from Brown University and Lifespan, Dr. Angie Caliendo and Dr. Jonathan Curtis. They will be our co-chairs of the task force, and they will work with Dr. Nicole and her team to do what's required to validate the test, set up the study, and then evaluate the outcomes. I want to tell you it's going to be weeks, not days, before we have results to share. I'm sure one of the first questions will be, Governor, when are we going to do this random sample? How many people are we going to sample? And when are we going to have the results? The answers are, let's let the task force and the experts do their work. And I don't know, but I do know it's going to be weeks, not days, because we want to get it right. In the meantime, if you have symptoms, if your doctor tells you you need to get tested, go do that at one of our testing centers. We're still going to continue to test 3,000 plus people a day. I'm happy to answer any questions about that. Okay, moving on to some more of the economic factors related to the crisis. So throughout this crisis, I've been telling folks to stay home if you can. If you can work from home, you have to work from home. Having said that, some of us have to go to work. That's just a fact. There are many of us who have had to go to work every day. And if you're one of those people, I want to thank you. I want to thank you for your courage and your stamina and for everything that you've been doing to keep the people of Rhode Island safe. I've said it so many times, I'll say it again. You really are heroes. Every single person who goes to work every day feels a little nervous. Myself included, all of us. And if you go to work in a nursing home or communal setting or assisted living or a group home, that's triply true, or a hospital. So I want to, again, thank you and let you know you are top of mind for me. You inspire me, and we want to do everything we can to support you. It's been a tough time. It has been such a tough time, especially for those providing care on the front lines in communal healthcare settings, nursing homes, group homes, assisted living, and the like. These operations are 24/7. You interface with patients, and this is where we've seen the outbreaks of the virus. Added on to that, many of these employees who are caring for our loved ones in these communal settings are low-wage workers. These are folks who go to work every day making $12, $13, $15 an hour under very trying conditions and making it so that our loved ones can be cared for. Not surprisingly, we are hearing of staff shortages. We're hearing, particularly from nursing homes, group homes, serious staff shortages. That is a reality. I had been hoping that by now the federal government, the Congress, would have done something to provide a wage subsidy to help us stabilize that workforce. And I still hope that that will happen. And by the way, I want everyone to know that our federal delegation, our congressmen and senators, favor that, and they're working hard for it. In the absence of that, I've decided to take action, because these folks, we have to help them and we have to send them some relief. Frankly, we have to give them a raise for doing the job that they're doing, and also help to make sure that these staff shortages don't continue, because we need to fill these shifts. So I'm very pleased to announce right now a Congregate Care Workforce Stabilization Fund for private providers in Rhode Island. The fund will provide temporary pay increases for the next month to low-wage frontline workers at eligible Medicaid-funded residential facilities. So again, residential communal, nursing homes, group homes, homes for the developmentally disabled. These raises, these wage subsidies are targeted at people, available for people that make $20 an hour or less. So again, these are really the people doing the hardest work under the toughest conditions at the lowest wages. Starting next week, employers can apply to the Office of Health and Human Services. This isn't forever. We cannot afford to do this forever, and I am optimistic that Congress will do something. It's temporary, but it's now. I want you to start receiving a raise in your paycheck as soon as possible. So starting Monday, we're open for business. I'd encourage the providers to apply, and we want to see this in the paychecks of folks starting that first week of May. We also know that these congregate or communal care settings need additional supports. I hear it every day, all kinds of additional supports. More testing, more PPE, more information. So I hear you, and to that end, starting this weekend, starting tomorrow, I've directed the Rhode Island National Guard to provide additional support in these communal care settings. So the Guard is assembling teams of professionals to provide additional support to nursing homes, group homes, and the like. They're going to help with infection control. They're going to help with PPE guidance. They're going to help with testing questions. They're going to help you. Help is on the way. That is my message. If you're in a nursing home, if you're in a congregate care setting, help is on the way. These are experts. They know what they're doing. They've been dealing with this, and they're going to come to you and provide you with on-site help. So again, it's not enough. I know it's not enough, but it's a lot. It's more than we've had, and I hope it responds to some of the anxieties, justified anxieties that many of you have and you've been dealing with. And thank you. Thank you for working through it and sticking with it. Okay, more news on the economics of this. So I say every day, and I read the emails and get correspondence every day from Rhode Islanders who are struggling beyond belief. It's really tragic, the economic devastation that's happening. And sadly, the crisis is hitting those who can least afford it the hardest. You know, as I said, if before COVID-19 you were struggling, you were in a low-wage job, you could barely make the rent, you are really struggling now. And I just want everybody to remember that, especially those of us who are lucky to not be in that position. I want you to know a lot of Rhode Islanders are really, really hurting right now. And they don't know how they're going to pay their rent. They don't know how they're going to pay their bills. They don't know how they're going to continue to go on like this, which is why every day I begin my day by saying, how can we provide you more support to get through it until we can get you back to work? So I have a little bit of relief and some good news for folks who are worried about paying your bills and, frankly, affording a place to live. Because I don't want you to worry about that right now. You have enough to worry about. I'm proud to announce now that more than 20 financial institutions in Rhode Island have pledged to step up and help our community in this time of need. They've pledged the following relief to residential borrowers. First, a 90-day grace period for all residential mortgage payments for individuals impacted by COVID-19 with the opportunity to ask for additional relief. Second, an agreement to not report late payments to credit reporting agencies for residential borrowers who take advantage of the relief. So it's a 90-day grace period for your mortgage payment, and they won't report it to a credit rating agency, so it won't affect your long-term credit. A 60-day moratorium on initiating residential foreclosures and evictions. And finally, an agreement to waive mortgage-related late fees. The last thing you should have to deal with right now is a late fee. Thank you. This is a very big deal. The list of the participating financial institutions will be made available today on the DBR website, dbr.ri.gov. It includes credit unions, small banks, community banks, and some of the biggest banks that operate in Rhode Island. You're doing the right thing. You are doing the right thing, and as your governor, I am so proud of you. Actually, I want every Rhode Islander to take a minute and go on the DBR website and look at the list of those 20 financial institutions who are doing the right thing for the right reasons to support our community. And if you're hearing me and struggling to pay your mortgage and worrying about late fees, I really want you to go to that website and see if your banker is there, because there's some good relief on the way. That initiative, which is collaborative, that's not due to my regulation or executive order. That's us reaching out to the community and them stepping up to do the right thing. It would not have happened without the leadership of Commerce Secretary Stephen Pryor and the president of the Commerce Corporation, Jesse Saglio. Huge amount of shoe leather and work and effort went into that. Hats off to both of you and your teams. And I hope it provides everybody out there with a little breathing room, because I know times are really tough right now. I do want to remind everybody that courts are closed for non-essential business through May 17th. So again, breathe a sigh of relief. You cannot be evicted. You can't be evicted between now and May 17th because the courts are closed. I also want to announce that starting next Thursday, we'll be making available $1.5 million in rental assistance for the lowest income Rhode Islanders across the state. I need more time to finalize the details of that, so next week I'll let you know precisely who's eligible and how we plan to administer it. But it's Friday, people are anxious, so if you're a low-income person and you're stressed about paying your rent, I just want you to know help is on the way. I just need a little more time to figure out the details, but we're gonna do our best to help you out. A couple more things. Hang in there with me. We've been busy. Earlier today, the president signed the Paycheck Protection Program extension. I'd like to thank him for that, and again, thank our federal delegation. I can't emphasize how hard this past few weeks have been for the small businesses of Rhode Island. All of you are being so brave and so creative and so resilient. It's unbelievable to me. But I know you're hurting. I used to run a business. I know what that's like. You have employees, you have bills, you have debt, you have creditors, you have customers, and it's a very anxious time. So I want to give you a little bit of good news. Congress has replenished the payroll protection program. If you recall, it came out before and ran out of money very quickly. I also know many of you struggled to figure out how to access it. So this is a message for you. There's more money now available in the payroll protection program. You can apply for this funding through your financial institution, your bank. Call your bank. Call your bank right now if you need a loan and you haven't gotten it yet. I don't know when the applications will be processed, but every business that needs help should be talking to your banker. In fact, if I were you, I'd stop listening to this press conference and go call my banker. Don't delay, do it now. The quickest way to get information, including what kinds of documents that you'll need when you're calling your banker, is to go to the Commerce RI website. I've heard from so many of you that it's confusing, the paperwork is confusing, you can't figure out how to do it. And I know the federal government was moving fast to get this out the door, so that's sometimes what happens. So if you're not sure, go to commerceri.com, and we've done our best to simplify it for you. Now, this is another important announcement. If you're a small business and you don't have an existing relationship with a banker, you say to me, Governor, we don't have a banker. We don't have an existing line of credit. We're too small for that. Then I want you to write this down. I want you to email ppp@commerceri.com. Shoot us an email at ppp@commerceri.com. And we're going to get you matched up with an available financial institution and make sure we do everything we possibly can to get you the money that you need through the PPP program. This is a big deal, because I know some of you said you just can't call your banker. We've been working very hard, and we have some good options available for smaller businesses or any businesses that are unbanked. But move on this quickly, because we know there's going to be huge demand. ppp@commerceri.com, and we'll help you out. We'll get you hooked up with the bank, and we'll do our best to get you the funds. Commerce hosted a Facebook Live event earlier today. They tried to answer frequently asked questions about the program, and the event is saved and can be replayed on the Commerce Facebook page. So I'm happy to answer any questions about this. I know that's a lot of information, but it's good. That's good news, and I hope it helps you. Okay, a couple of more things I have to get through, and I appreciate your patience. So for weeks now, we've been working around the clock to prepare our hospital system for a surge. And again, I cannot thank enough Care New England and Lifespan, the National Guard, EMA, the building trades unions, all the men and women that worked overtime to make it so that we have our field hospitals available. While we've been doing that, we have asked our hospitals, and our hospitals have on their own, curtailed non-critical surgeries. And that was the right thing to do. It happened all over the country. It was necessary. We now need to get back into the business of allowing hospitals to do some of these non-critical surgeries. If you're a patient who's been inconvenienced, I'm sorry that you've had to wait. If you've been waiting to have your surgery and you've been told it had to be rescheduled, that's at best inconvenient, at worst, causes health issues. So I am in a rush to help you get rescheduled safely. If you're a hospital, this is a key source of revenue. Throughout this, we have to make sure that our hospital system is secure and financially stable. They did the right thing by shutting down these non-critical surgeries and focused on the surge. But now we need to do the right thing and work as hard as we can to help them begin again some of these non-critical procedures. It isn't just surgeries, it's procedures that they're in the business of doing, so they can take care of Rhode Islanders, and so their bottom line starts to get a bit healthier. So with the Department of Health, we have directed every hospital to provide to us by Monday their plans for how they can safely begin again these non-critical procedures. And it's going to be different. They have to account for infection control, different workflow, isolation of patients, make sure they have enough PPE available, make sure they have the staffing. It's a long list. I don't want anyone to think we're just reopening without a great deal of thought and care and the appropriate equipment. But it's time. It's time that we start to do this. It is a big step forward, and I look forward to collaborating with our hospitals to make this happen. I will say, as I've said before, when we get to the business of reopening our economy, it will happen in stages. And this is a great example of it. This is a beginning stage. Hospitals are very well positioned to be able to enable this safely, and it's necessary for them and for the people of Rhode Island. So thank you to the hospital administrators for working with us, and we look forward to working with you on your plans. After we see the plans, evaluate the plans, work collaboratively with the hospitals, I'll be able to come back and say, give you a date by which some of these hospitals will be incrementally bringing back some of these procedures. Finally, I want to take a minute to talk about something that is difficult to talk about, which is the increase in violence, domestic violence, in our community that we have seen since this pandemic began. So, and I've talked about this before, and a few of you have said, why are you talking about that from a press conference? Because it matters, and it's important, and it might make you uncomfortable, but we have to keep everybody safe, and that means keeping everybody safe in their home. So the sad reality is that while we've all been cooped up in our houses and struggling financially, our kids are learning from home, everybody's anxiety is higher, we've seen a big increase in 911 calls on account of abuse happening in the home. And that's not okay. So we have to come together as a community to do everything we can to reduce that and alleviate that. The fact of the matter is, not everybody is safe at home. And unfortunately, that seems to be doubly true now. So if you're hearing me say this and you feel unsafe, I want you to reach out for help. If you're hearing me say this and you are safe, I still want you to pay attention, because maybe somebody in your neighborhood or at your place of work isn't. And I want you to be extra aware of that and know yourself how you can reach out for help on their behalf. I directed my team several weeks ago to put together a plan, a comprehensive plan to deal with this, because we've started to see the increase in 911 calls for several weeks now. So the team worked with advocates, and they put together a comprehensive resource document that's now available on the Department of Health's website in English and in Spanish. The document is meant to be a resource for everybody. I also want to remind everyone that hotlines are still available, shelters are still available, all of the supports that have been available in the past are still available now and have capacity to take care of you. We've checked in, and the system has capacity to take care of you and keep you safe. I also want to let you know that next Thursday at 11 a.m., I'll be joined by our federal delegation, Senators Reid and Whitehouse, Congressman Langevin and Cicilline, and Attorney General Noronha, and advocates from the community and members of my cabinet to do a violence prevention Facebook town hall. We'll be advertising for that, but I would encourage all of you to try to tune into that. As I said before, it's just an opportunity for us to become informed. So if you are lucky enough to be in a safe, secure home surrounded by loving friends and family, then that's great, and I'm happy about that. But I still want you to get informed, and I still want you to try to participate in that 11 a.m. Facebook town hall. Because I guarantee you, I promise you, there's somebody in your life who isn't. And it's your job to get smart and reach out to help them to get safe. So, last thing, if you want to send me an anonymous email so that I answer questions at that Facebook town hall, please send email to communications@governor.ri.gov. Don't have to identify who you are. Just send the email. It's secure, and I'll do my best to provide an answer. And if you want to identify yourself, that's great, and we'll reach out to you. Okay, that was a huge amount of information. I hope it is helpful. I'll turn it over to Dr. Nicole and come back to answer questions.
Thank you, Governor. Such important messages for you to be able to stay safe and to reach out for support. Please heed those messages and know that there are services available to people. So to those of you who are still watching, because you haven't left to go call your banker or to email Commerce PPP program, good afternoon. I also want to thank the leaders of the Rhode Island COVID-19 Testing and Validation Task Force that the Governor referenced. Particular thanks to colleagues Dr. Angie Caliendo and Dr. Jake Curtis for co-chairing the group. You will be getting a lot of support from clinicians and laboratory experts in state government and outside of state government as well. The focus of this task force is going to be support for our work to expand testing in those communities that are being hit the hardest right now. There are ways, a number of ways that we will be able to do this, and we want to do it as strategically and as science-driven as possible. As the Governor was saying, the ways to do it include a current diagnostic test that we're doing, which we are calling PCR testing, or it could be the serology or antibody testing. Oftentimes, a combination of both allows us to be most effective in understanding the best way to assist. Having this information will inform our work at the state level and will help us identify people who are positive in some of our hardest hit communities before spread occurs, so that we can do our best to really address that in advance. This is a general public health principle we are applying here of focusing resources where the health issue is most acute, where it's most needed, with the understanding that this is what will have the greatest benefit for those communities and for the state as a whole. Our health as a state depends on all of our communities being as healthy as possible. In terms of the numbers for today, as the Governor may have mentioned, we have 437 new cases for a total of 6,699 cases. Sadly, we also have 13 new fatalities. 2 of these people were in their 50s, 1 person was in their 60s, 5 people were in their 70s, 3 people were in their 80s, and 2 people were in their 90s. It's important to be able to extend our deepest condolences to those families of the people who have passed away. As always, we have updated, detailed information posted on our data dashboard on the Rhode Island Department of Health website for all of our COVID-19 cases. We also have the case information posted online by zip code today. This is something that we have spoken of, and I shared that our team is working extremely hard to get that data to you. It is available, and we will be continuing to provide additional details as we go forward. I want to give a huge thank you to our data team at the Rhode Island Department of Health. There are teams of people who have been working to get more and more data online to help us understand how COVID-19 is impacting communities throughout the state. And there are teams of people across state government who have been working together on helping to make this happen. So a thank you to all. We know from the city and town data that we have online that we are seeing higher numbers in certain cities. We now see on a map that will be posted online that certain zip codes in Providence and Pawtucket, for example, are the places where we are seeing even greater concentrations of cases. As the governor has been saying, and as I've been saying, it is critical that we get the testing and support services into the communities where we are seeing the most cases. Another example of such a testing site, in addition to what was shared earlier, is the Comprehensive Community Action Program's Cranston Health Center at 1090 Cranston Street. The Comprehensive Community Action Program, or CCAP, is one of the organizations in our health equity zones infrastructure, which, as I've described in the last few days, is working in communities on the front lines throughout the state to help narrow health disparities and make sure that everyone has an equal opportunity to be healthy. This is our goal, giving all Rhode Islanders in every zip code throughout the state an equal opportunity to be healthy and to live in the healthiest community they can live in. This new site in Cranston is a drive-through site, meaning that people are being tested in their cars. This site is running Monday through Friday now, but will expand as needed. To get tested there, you need to call and make an appointment. And to make an appointment, you can call 401-943-1981. When you call, you're going to get connected to a healthcare provider, and that healthcare provider is going to talk to you about your symptoms. This is a good moment for me to remind everyone that people should be tested if they have symptoms. That is when testing is most accurate and effective, and it's what we want to encourage for anyone with symptoms. Remember to just call your healthcare provider or call an urgent care center and get connected to the nearest testing site that's available to you. And as we've been saying, we're working to get more and more opportunities into the communities, particularly those that have been most impacted. There are some special settings in which we are taking a slightly different approach, a more aggressive approach, such as in our congregate settings, nursing homes, as I've shared previously. But for the vast majority of Rhode Islanders, we want to really continue to extend that message. You should be getting tested if you have symptoms. That's how we're going to continue to expand, understand where people are being impacted, and make sure that you have the resources needed to be able to isolate effectively and to have your direct contacts in your household or who have been around you be able to quarantine. Doing that is the most effective way to help stop the spread of COVID-19. We're doing a good job together, everyone following the stay-at-home order. We have seen that stopping the spread works from that perspective. As we look forward to reopening the economy, we want to make sure that we have those tools in place so that we can continue to be pinpointed and targeted in our ability to continue expanded testing and implement the contact tracing, isolation, and quarantine procedures that we know work. So thank you for helping us get through this together. Continue to hold on as we go forward. With that, I'm going to open us back up for questions.
Good afternoon, all.
Good afternoon.
And to our viewers at home, happy Friday. I'm Margie O'Brien. I'm a host of Capital TV, and I've been asked to pose questions submitted by reporters all over Southern New England to our Governor, Dr. Alexander Scott, and DOA Director Brett Smiley. We're going to begin with Tara Granahan from WPRO Radio. Governor, to follow up, and since Mayor Elorza held a Twitter town hall at the same time as your briefing, have you spoken to the mayor and Spanish radio stations in order to get them more involved?
Yeah, I have, and in addition, I'll be doing a town hall with Commissioner Infante Green next Tuesday evening, focused on the Latino community. Members of my staff have been doing Latino Facebook and radio. I'm going to start to do more. I have a meeting this afternoon with the Latino advisory group that I put together. So we are really trying to double down on our efforts. And certainly I would encourage the mayor, he's doing it. We all need to do more for exactly the reason I said at the beginning, which is vulnerable populations, non-English speaking populations. We really have to keep our eye on that so we don't have an outbreak. And so we keep everybody safe and healthy.
Next question is from Tim White of WPRI Channel 12. I believe this is for the doctor. Data shows Central Falls now has the most cases per capita in Rhode Island. Besides population density, is there something going on in that community that would explain what's happening?
It's what we are continuing to unpack and understand. We do know that certain communities have higher proportions of people who are members of the critical infrastructure workforce and need to be able to go into work. So a big part of our focus is helping to make sure that entities where we have larger communities of people from certain areas have the support they need for social distancing, for screening, and for face cloth coverings or masks that need to be worn. But the engagement that the governor referred to with community members, the messages that I have said with our health equity zones and many others throughout the state are going to be key to help us understand what additional measures do we need to take to address the number of cases that we're seeing in certain cities, communities, and zip codes. So work is continuing to be done with that.
Sure.
The only thing I was going to add on, I mentioned that we're doing the walk-through sites, and we want to have a walk-through site in Central Falls to do more testing. Lots of people don't have cars. We want to be in the community, and then we'll get more information. So I just thought that was important to say. I mean, Nicole's right. We need to do more, and that's a community that's heavily affected, and so we will do more.
Next question is from Michael Bilo of Motif Magazine. U.S. Senate Majority Leader Mitch McConnell said in interviews he objects to giving free money to governors in a blue state bailout and suggests the bankruptcy route, including defaulting on pensions. How will this affect Rhode Island? How would you respond?
We are not going to declare bankruptcy. We are not close to that. I'm not going to let that happen. So that's point number one. It's going to be tough. Balancing this budget will not be easy. We will not default on pensions, not as long as I'm governor, so that's also out of the question. Also, it's not blue state. I was on a call an hour ago with 48 governors on the call, and Democrat and Republican alike are saying the states need more assistance. In fact, President Trump himself has shown public support for a $500 billion additional state and local stimulus. And I've been on the phone with our federal delegation in the past 3 days, and there's a fair degree of confidence that there'll be another stimulus bill coming to states and localities, which, by the way, is necessary, and I'm going to keep fighting for it. So, I think that's a lot of political rhetoric, which is what it is, but what our job is to do is fight to get the stimulus because the people of Rhode Island need it and deserve it. Frankly, the people of America do.
Next question is from Richard Asnoff of Convergence RI. 2 BH-Link workers tested positive for COVID-19, yet remaining workers on the job were told that they cannot be tested for days, putting them at risk, according to sources, risking BH-Link becoming a hotspot. Why delay testing for healthcare workers doing essential jobs on the front line?
Thank you for that question, Rich, because it is important for us to make sure that testing is done in the particular settings where we know it can have an impact. That has been our focus and continues to be. So I'll engage with our team, and I know work is being done to make sure the appropriate infection control and testing strategy is implemented. We do know because of the number of tests being done, the supplies that are available, there may sometimes be a time frame where we're working to close that gap and make it as soon as possible. But I'm sure the message is that we want to support the staff there at BH Link for the important work that they do and help make sure they get tested. So I appreciate this being raised.
Doctor, the next question is from Kathy Gregg of the Providence Journal. I'm going to break it down in stages. How many of the nursing home fatalities happened in a hospital, and how many in a nursing home without ventilators and ICU level care?
That's data that I can work with our team to provide a little bit more information on. Many of the nursing home fatalities, unfortunately, did occur in the nursing home where they were being cared for, oftentimes with people not having very prominent symptoms, but because we have talked about the fact that this is a very medically and physically fragile community within the nursing home, sometimes a small shift in their hydration status or temperature or appetite and ability to eat as a result of a viral infection could contribute to an unfortunate outcome. So that's what may be happening in certain situations within the nursing home setting. I've shared before, as it seems as if it's understood, that ventilators and ICU settings are really made for a hospital where acute care is occurring and not so much in a nursing home setting.
And to continue Kathy's question, do the nursing homes have Rhode Island Department of Health approved standards for who goes to hospital, who doesn't?
Yes, there's an overall understanding with the medical directors overseeing nursing homes as well, the staff, all understand that when there is a concern for the residents, they're very familiar with the need and ability to get someone transferred to a hospital to receive more acute level care that exists. We work very closely with nursing home facilities to support those approaches, which they understand and follow very well.
Governor, the next question is for you from Brian Crandall of NBC 10 News. What do you say to critics who point out that hospitalizations are staying steady and remain well below projections and call for quicker businesses reopenings as more than 180,000 Rhode Islanders are out of work?
Yeah. Look, it's a fair question. It's a question I ask myself every day. So first of all, it's a good thing that we are holding steady. You know, as I said at the beginning, we're holding steady where we are. That is a good sign. And hospitalizations are holding steady. A good sign. It means we've done the right things to control this. I just made an announcement today that we want to get back into the business of helping our hospitals to get back into business. On Monday, I'm going to have a lot more to say about reopening our economy. The stay-at-home order expires on May 8th, so we're going to get there quickly. And next week is going to be a number of announcements about when and how and who will be able to get back to work. So I'm as anxious as anybody. Having said that, you look all around the country and the world, really, and you see that there are risks for jumping the gun or going before you're ready. This Monday, I laid out very clearly 6 metrics, 6 benchmarks that have to be in place. And it is my duty to the people of Rhode Island to make sure that we are ready before we hit go. And we're going to get there. We're going to get there very soon. I've already started to make some announcements today around hospitals, and Monday I'll have a lot more to say.
Bill Bartholomew, asks, Governor, any plans to expand pressers, infographics, etc., into languages beyond English, Spanish, and American Sign Language? Is there an info hub for other language speakers?
It's a good question. Much of the information that we're putting out, we're trying to put out in multiple languages. I mentioned yesterday that for the walkthrough sites, it's Portuguese and English and Spanish, but maybe we could do more, and that's something I'll take into account. We've also made adjustments to those who are seeing impaired. You know, each time we get this feedback from different communities, we try to do a little bit more, so I'll take that feedback.
Next question is for Dr. Alexander Scott from Hannah Dickinson at WPRI Channel 12. How often are you seeing COVID patients dying from blood clot complications? How big of a concern is this right now for patients in Rhode Island?
I appreciate that question. I don't have the data right with me in terms of the number of times there has been a blood clot associated with an unfortunate death. But our concern does not exist in terms of any particular trends that we're seeing. It's more similar to what I explained earlier in regards to a viral infection like COVID-19 impacting a medically fragile or physically fragile population leads to that risk for the negative outcomes that we are referring to. We'll continue to monitor the data, though, as well as along with states throughout the country to see what else we can understand about risks and what's occurring in people who have unfortunately passed away.
Governor, the next question is from John Howell at the Warwick Beacon. He notes that the question was raised yesterday during Governor Baker's press conference whether he would consider Massachusetts declaring bankruptcy. And he asked, given the tight financial situation and even with more than $1 billion in federal aid, is this an option being discussed for Rhode Island?
Yeah, no, it's not being discussed, certainly not being discussed now. We'll know a lot more in a month from now around our actual financial situation. We'll know, right now, we still don't have a good handle on exactly how much stimulus money is coming into the state. Literally every day we get more information on additional stimulus for hospitals, just today the president signed a bill on additional federal money for testing and PPE. As I explained earlier, Congress is very likely to pass another stimulus bill to make up for revenue shortfalls for cities and states around the country. So in a month, we'll have a better sense of what does the state's revenue look like, are people getting back to work here, what's our total federal stimulus, and then we can really get to work and start to think about how do we balance our budget. But no, bankruptcy's not on the table. That would be a horrible outcome for any state. It's never happened in our country's history. And it's not time to start thinking about it. It's time to start thinking about how do we get creative and solve our problem and balance our budget, and that's what we'll do.
ABC 6 News Director Kelly Johnston asks, we spoke to a hair salon owner who wrote to you asking if there was a way to reopen salons earlier than you're planning now. Are you hearing any ideas that might allow salons to reopen sooner, and how are you handling your hair?
Sorry. It's long. It's overgrown, like a lot of people's. So I haven't said anything about when salons would be reopened. I would like to get them opened as quickly as possible. And this week we've made a lot of progress on that, talking to salon owners. And I think there will be ways to safely reopen barbershops and salons, with appropriate cleaning on a daily basis, limited number of customers, keeping customers far apart, wearing cloth face masks, So we're on it, and I think I'm hopeful you'll be pleasantly surprised with what we come out with. And in the meantime, just remember that you are eligible for unemployment insurance, hairdressers, barbers, salons, even though you haven't ever been in the past.
Christian Winthrop from the Newport Buzz asks, in response to coronavirus, you've done what was necessary to make distance learning successful. When do you think it's time to take this a step further and mandate the regionalization of schools to reduce system-wide redundancies and waste while cutting costs as Rhode Island faces enough economic times?
Yeah. So let me say this, to give you a view for where we are right now. We are very much every day in the trenches fighting this fire that is the coronavirus. So just to give you a feel for it, I spent all night and most of the morning on the phone with Director Gaynor because we can't get our hands on enough gowns. We are still struggling to get our testing really where we need it to be. We spend every waking moment trying to figure out how to get hospitals back in business, how to get hairdressers back in business, how to get money into the pockets of small businesses today to roll out this new PPP initiative. So eventually, we will get to the business of answering excellent questions like you have, which is, okay, how do we do some restructuring to be thoughtful and creative to balance our budget in very tough times? We're just not there now, and I can't take my eye off this ball right now. We've got another month ahead of us of, you know, we're trying to reopen an entire economy in the face of a global public health pandemic, and we're going to nail that for the people of Rhode Island. And then we're going to get to the really hard work that you're talking about, which is, how do we make the tough choices? And I am absolutely open, and I agree with you. It's time to get creative and innovative and reform-minded and figure out how do we make difficult fiscal choices and be creative and make sure, most importantly, that Rhode Island and our workforce is more resilient and better skilled on the other side of this than we were going into it.
Our last question today is from Stephen Triedman of Eastside Monthly. Your daily analysis cites all of the cases in the 39 cities and towns. Can you extend this breakdown to the 85 zip codes so people can see the COVID-19 picture in their own neighborhoods?
Why, yes, Stephen, we can, and we are today. So those maps will be coming up. I want to again thank the tremendous work of the data teams at Rhode and across the state that makes us probably one of the only states that has zip code level data so that we can better understand how to be targeted in getting to the communities most at need. So thank you.
Thank you.